Hello, my name is Toni Cecil, and I'm a second-year student in the Master of Athletic Training program. The research I'm presenting is over the effect of whole-body reactive agility training on volleyball player performance. My faculty mentor for my research is Dr. Scott L. Bruce, and my co-authors are Dr. Robert Bradley and Dr. Carlita M. Moore. Whole-body reactive agility is an important quality for volleyball athletes. Their reaction time, which is the period between a stimulus and a response to that signal, is one of the most important aspects in the sport. Elite athletes, such as intercollegiate volleyball players, can react accurately and quickly to visual cues, such as having the ball spike towards them or a tip being pushed over the net. For my research, I use Tracer technology, which uses computer-based simulation to create an accurate analog of the functional challenges of sports, work, leisure, and daily living activities. It uses full-body sensing and projects an avatar of the participant to measure analytics to provide information from the athlete. Baseline and post-test involved 4 activities: lateral agility, which is when athletes move side to side based on target appearance; lateral flanker, which is when athletes respond to a central arrow direction to hit a virtual target, moving right to left; diagonal agility is when athletes move back and to the right or left based on target appearance; and diagonal flanker, which is when athletes respond to a central arrow direction to hit a virtual target, moving back right or left. Single task and dual task training was involved throughout the testing. Single task training is when targets show up until they are hit without any secondary task requirement. Dual task training, which is also considered the flanker test, is when a central arrow direction dictates the motor responses. The purpose of this study was to train NCAA Division I volleyball players with Tracer to determine if a positive change in volleyball game statistics was possible. For my study, 15 intercollegiate volleyball players volunteered to take part. They were baseline tested on the Tracer prior to the 2019 season to assess their whole body reactive agility. After baseline testing, the volleyball players were trained on the Tracer twice per week for 3 weeks with a variety of 3 exercises. These training sessions lasted about 5 to 7 minutes per session, depending on which exercises they were doing for that training session. Once the 3 weeks of training was complete, the volleyball players were post-tested by repeating the baseline tests. Independent t-tests were ran and used to compare the Tracer variables and game statistics. Paired t-tests were also used to assess the differences between baseline tests and post-tests. With the results of the study, there were no statistically significant changes to volleyball game statistics found. There was poor statistical significance and correlations between Tracer data and volleyball game statistics, which is being attributed to the fact that the Tracer training only lasted 3 weeks. The table that is presented is of the paired t-test results, with only 8 of the parameters being statistically significant. However, there were several positive outcomes and improvement with the Tracer training. Lateral agility saw 66.7% of the athletes improve from baseline to post-test. Diagonal flanker saw 64.3% of the players improved over the course of the training. 35.7% of the players improved on the lateral flanker. Diagonal agility saw 46.2% of players improve from baseline to post-test. 83.3% of the players' reaction time improved, and time differences between right and left directions known as asymmetries improved by 81.3%. Training on the Tracer for only 3 weeks produced several positive changes and clinically significant results. Future research ideas could include increasing the length of the training time, increasing how long each session lasted, and figuring out how long throughout the season the training should last.